Hello, thank you for joining us. My name is Lucinda Nord and I'm with Indiana Association of United Ways, and we are glad to welcome you to our Indiana Human Services Legislative Update webinar. If you have not already, if you are the type of person who likes to take notes as we go along, we do have some slides, both in notes format and in the slides format, posted at inrn.org, and we will begin shortly. So just a couple administrative pieces. We do have the slides uploaded, and we are very appreciative of our partners that made this webinar today happen. We here at Indiana Association of United Ways have a wonderful partner through the Indiana Nonprofit Resource Network, which is a statewide training organization, and you can see the logo there and the website at the bottom. We invite you to consider some of the trainings that are available in your local region. And then one of our core coalition partners is the Indiana Coalition for Human Services, and our two speakers today, myself and Mark St. John, serve as the co-chairs for the Government Affairs Committee of the Indiana Coalition for Human Services. ICHS is a 25-member organization that is an organization comprised of human service providers and human service advocacy organizations that work to influence policy. So let's begin. What we're going to cover today in this one-hour webinar is to give you a quick federal update about what's going on at the federal level. And then we're going to focus the bulk of our time on what's happening in the State House today, what we anticipate the legislature to enact this session, and then we're going to talk to you about how you can stay more informed during the session and influence policy. So if you have questions along the way, we will stop throughout the session. If you have questions, feel free to use the chat box. They're in the right side or the left side, however you have your screen configured. You can type your questions. We also will stop at the end to take questions, and we'll have our contact information where you can contact us directly. So we are very pleased to, again, thank Lisa Hanger with the Indiana Nonprofit Resource Network and Mark St. John of St. John and Associates, and also my co-chair with the Government Affairs Committee of ICHS. So let's begin. First, at the federal level, you may have just rewind just a few weeks. It seems like forever ago. But you might recall that we had this major fiscal cliff crisis looming at the end of 2012, and that was the combination of the expiration of the Bush-era tax cuts, some other tax cuts, and then some anticipated spending cuts that were, or automatic sequestration, that were all to take effect effective January. They were not able to make a deal by the end of the year, but because New Year's Day was a holiday, they actually negotiated a New Year's Day fiscal cliff deal, and it included a number of provisions. Primarily, the fiscal cliff deal focused on tax issues, and it is thought that the subsequent deals later this spring, this winter and this spring, will deal with the spending side. So let me just review a couple of those. Most of you know on the service side that the automatic cuts that were supposed to go into effect in January were delayed by 2 months. A number of other changes you can see there on the screen. Long-term unemployment insurance was extended. The doc fix was extended. SNAP and TFAP benefits were extended without any cuts. Additionally, there were lots of tax credit and deduction provisions. One of our highest priorities is preservation of the charitable deduction from a United Way perspective. And I know that there's been a lot of confusion about the what actually happened in those negotiations, so let me just clarify, because some of the media reported that charities were hurt with this slight modification. But basically, the charitable deduction was not capped or limited as had been discussed or proposed. What they did do was, was to reinsert an old provision called the peace provision that had to do with basically trimming the value of itemized deductions for very high income taxpayers. So while they may have been able to deduct a slightly higher amount in prior years, in the most recent years, this reinstated provision simply limits that slightly. It will have almost a negligible effect on overall charitable deductions when you contrast it to the potential that we might have lost the charitable deduction. So we're very pleased that the charitable deduction continues. A number of other important tax credit provisions were maintained. Another one of our highest priorities from Indiana United Ways and from Indiana Coalition for Human Services is the Earned Income Tax Credit, EITC. My apologies for not spelling that out there on the slide. Earned Income Tax Credit was extended for 5 years. The Child Tax Credit, Teacher Tax Deduction, and a number of other tax credits and deductions were also extended. There were a number of other tax issues that were a part of these, the New Year's Day deal, including the IRA charitable rollover, which was basically retroactively reinstated through the end of this year. So we would imagine that that fight is going to continue later this year. Probably one of the most noteworthy of the provisions was around the estate tax, where there was a big discussion about, you know, at what level should that estate tax be applied. What affects everybody is the payroll tax, the rollback of the stimulus provision that was created during the height of the recession, was that 2% payroll tax cut, and that did expire, and the fiscal cliff deal did not extend that, and most people are already feeling that in their first paychecks. It's not significant. It actually simply rolled it back to what it was prior to the recession. And then the other big component were the changes to the tax rates, and again the big discussion was what is considered a higher income person. So the tax cut threshold was really made at the $400,000 for singles and $450,000 for couples, and their tax rates went up from, or will go up from 35% to 39.5%. Again, much less than in prior years past, but still more than the most recent past. So what's happening now, the big debate right now, and what we will anticipate for the coming months, are related to the debt ceiling and the continuation of the budget. Just yesterday, the House passed what they're calling the No Budget, No Pay Act, and basically that bill suspends the debt ceiling temporarily through May. As you might have known, the debt ceiling was to be reached during the month of February. And while the federal administration can do a number of, take a number of actions to limit payments, to freeze payments, to extend the life of that debt ceiling a little bit longer, this No Budget, No Pay Act basically suspends it through May, which is intended to incentivize lawmakers to pass a budget resolution by April 15th. It's not to actually pass a budget, but to pass a budget resolution or face a no pay provision. And it's not that they won't actually get paid. Their pay will simply be suspended. That debt ceiling deal that was made yesterday, it's not a deal yet because it hasn't passed both chambers, but the House version encourages budget negotiations before, excuse me, I don't have a date in there, but before March, at which time the automatic sequester of about $1 billion is supposed to start. It also encourages budget negotiations before the end of March in order to avoid a complete government shutdown. So those are the kinds of things that are happening at the federal level, and you can bet that we are going to see more acrimony and more negotiations really over spending. What we're likely to see is a real debate over entitlements and how spending should be reformed so that our spending will really match our expenses or our revenues that we bring into the federal government. So let's change gears just a little bit and talk about what's going in the State House. This year is the long session, or the budget writing session. It runs from January to April. We are creating the biennial budget. It's about $30 billion. It's House Bill 1001. A little couple factoids, in case you don't already know, that we have supermajorities in both chambers, and what a supermajority means is that the Republicans basically have more than enough folks to carry on with a quorum without even having the Democrats present. So there's the breakdown in the House is 69-31, and in the Senate 37-13, and almost half, not quite, but almost half the legislature right now has 2 years or less experience, which is very significant in terms of folks who work in the State House right now are still trying to figure out sort of the new relationships and the new power structure, because we have a lot of new committee chairs, maybe who haven't even chaired a committee in the past, and we're still trying to figure that out. You can find out lots of information about what's going on in the State House at in.gov/legislative, and we will show you that website a little later in the webinar. So now I'd like to actually turn it over to my colleague Mark St. John, who's going to give you a quick overview of some of the hot issues in the State House this session, and talk a little bit about what's going on both in the legislature and the executive branch. So Mark, take it away.
Thank you. Well, let me talk a little bit about the study committee stuff that happened this year. The real hot issue was around, as some of you may be aware, the Department of Child Services with reforms to the hotline and staffing and such. And that came out with...
Mark, excuse me, can you speak up just a little? Thank you so much.
I'll hang the phone here. Anyway, the DCS committee made a number of recommendations about staffing in the hotline and such. And in fact, 2 of those bills passed committee this week. A lot of discussion about child care issues that came from the study committee recommendations. A lot of this relates to child care ministries and what requirements should or should not be had of those child care ministries to receive federal funds from the Child Care and Development Fund. And that has not moved in the House yet, or in the Senate or House, either one. And then another big set of issues is around criminal sentencing. And that both of those things have started to happen. Some of you that may have followed this in the past would be aware that there have been 2 sessions ago, there was a comprehensive package put together that a group of prosecutors had concerns about and were able to stymie any movement with that. Though yesterday the Chief Justice Dickinson spoke to the need for the criminal sentencing reform. Overall, the hot issues are all about jobs. In fact, there was a press conference today by Speaker Bosma and by the House Minority Leader, Scott Peloff, both talking about some issues with jobs and Indiana Works Councils. There seems to be a strong emphasis on how do we help push job creation in Indiana. It was a focus of Governor Pence's State of the State address Tuesday night. The budget stuff is hot there at the State House, as it always is every 2 years. Indiana, for a variety of reasons, actually has a very high budget surplus right now. And that raises the issue, do we fund some of the things, for example, K through 12 education, that had received cuts or had been flatline budgeted over the last few years with the recession, or do we start to put some of those resources into other things that that had been cut here, or do we make a reduction in the income tax rates for individuals and businesses? That is something that Governor Pence is actively promoting. Another big factor goes back to what Lucinda was speaking of a moment ago regarding federal budget cuts. The potential for that is a big one, in that the state budget is so dependent on a variety of items that are covered in the state budget or federal budget, so that how that plays out, I think, will make some big differences in how the final budget looks for this next biennium. Healthcare. Healthcare is a big issue here. The part of it is with the state's implementation of the Affordable Care Act, how we handle the healthcare exchanges with that and such, and what's the future role for the Healthy Indiana Plan. The Governor Pence has said, and that's what the state's decision is as of today, that they will not run their own exchange in Indiana, but rather they will deal with the federal exchange. But at the same time, there are other adjustments to the healthcare industry and state laws that need to be made, and there is a bill in both the House and the Senate that are moving forward on some of those issues. Medicaid expansion is a budget-related issue in many ways. How much money do you put into that? In essence, because of Medicaid expansion being optional now, based on the Supreme Court ruling from the summer of last summer, it's an optional thing. So there are roughly 300,000 people in Indiana that make too much money to qualify for Medicaid as it currently is structured in Indiana, but don't make enough money to receive any tax benefits that are part of the Affordable Care Act for purchasing health insurance policies. So the legislature has to deal with, are they comfortable with that kind of a donut hole? Many legislators, regardless of party, are concerned about that, but the issue is how much will it cost and how can it be paid for? After a lot of activities around education, early education in the last couple of years, it's coming up again. There's strong emphasis by Governor Pence about how do we enhance and improve vocational education, things that will make Indiana's citizens more job ready, and it goes back to jobs again. But there's also a discussion about where does pre-kindergarten activities fit into that. There are a couple of different proposals out there about how do we improve early childhood education? Do we do it through pre-kindergarten activities? And if so, under what circumstances? Part of the discussion now is with vouchers for that pre-kindergarten stuff. But that also raises some different kinds of concerns. In terms of other kinds of things, there has been some statements by leadership, the Democrat leadership in both the House and the Senate, about kind of passing on social issues. Republicans have not necessarily said a lot, but there are the marriage amendment. It looks likely to still come up again this time. There's discussion about Indiana's marijuana laws. There are a couple of bills out there that deal with family planning resources and some additional restrictions on abortion. So that, along with what may come, the discussion that may come out of criminal justice, becomes may dominate parts of the conversation now. If you can move to the next slide, please.
And Mark, I'll just remind you to speak up because it's kind of hard to hear sometimes. So okay. I'm trying to get us to the next slide because we need to zip through this.
Okay. This is kind of a quick outline of Governor Pence's budget. He's calling for a 1% increase in K through 12 education, but at the same time, the second year is being discussed to be tied to performance outcomes. So that raises a lot of other kinds of policy issues here. The proposed increase of $6 million for Teacher Excellence grants to increase pay for high-performing teachers. But that brings back to the discussion about how do you evaluate and reward teachers and under what circumstances? I mentioned earlier the fully funding full-day kindergarten for Hoosier children is in the budget, and that there seems to be a growing consensus with that. He's called for the creation and investment of Indiana Works Councils to promote more workforce development. That was the piece of the press conference this morning by both the House and the Republicans and the House Democrats on that issue here. There is to implement the recommendations that came out of the study committee this summer about the Department of Child Services. It will take more money to add additional staff and other processes. And the governor's budget has proposed an increase of $35 million for the DCS operations. The bill does fully fund Medicaid as what has been expected to be what has been forecast for what they expect the increases will be without any Medicaid expansion. So it's nice to have that happen, but also recall that Medicaid is an entitlement program, and the state is obligated to pay every dollar that comes in here. So there are what fully funded means is a matter of interpretation. And then Governor Pence's budget also calls for cutting the state income taxes by 10% phased in over 2 years. There does continue to be some pushback about that. A proposal that was made by one of the members of the House Ways and Means Committee this week was that, okay, we could reduce the taxes, but we'll do that through eliminating the tax refund that Governor Daniels had promoted. So there are a variety of things that are being considered there.
Okay.
And,
thanks.
Kind of an overview there.
Yep. So let's move on and talk a little bit about some of Governor Pence's other first actions. And on the first day, he actually wrote and signed 15 executive orders, 8 of which simply continued either committees or boards or departments within state government. 1 rescinded a prior executive order, and then 6 new executive orders. The 3 that I'll call your attention to as human service providers would be 1, the continuation of the Office of Faith-Based and Community Initiatives, 2, which is the 8th one, excuse me. Then the 3rd executive order was around a moratorium on new regulations. Again, trying to make Indiana a business-friendly environment. And then lastly, the one that probably is most interesting to human service providers is the 5th executive order that creates family impact statements for certain Indiana departments and agencies. And you can actually go online at, I'll show you just very briefly. You can actually look it up online, and you can read that executive order or download it if you want to see how the, excuse me, right here. So the executive orders you can see, and you can actually pull up the one on family impact statements if you wanted to. So we'll zip back to our presentation, and we're just going to fly through a couple of those highlights that Mark had already mentioned in his overview about the hot issues this session. From Indiana Association of United Ways and Indiana Coalition for Human Services, we're very interested in education for all kids. From a United Way perspective, we're particularly interested in the child care quality and pre-K issues. We know, just to give you a quick update, there are numerous bills in the House and the Senate around child care quality. Again, as Mark mentioned, they came out of that summer study committee last year. We understand that there's a few very large sort of omnibus, meaning they cover everything, kind of child care bills, and then there are individual parts of those bigger bills like criminal background checks and curriculum or safety requirements if you take Child Care Development Fund vouchers or CCDF, those taxpayer-funded subsidies. There are a number of versions of the pre-K pilot, but the one that is probably the highest priority, as evidenced by its bill number, House Bill 1004, Generally speaking, when the House Republican leadership or the Senate leadership give a bill a very low number, they're really showing their level of priority for that. And House Bill 1004 would create a pre-K pilot program in 5 counties. There are a number of other bills. The Senate Education Committee, for example, will often, the chairman of that committee, Senator Cruz, will talk about how there are more bills in this assigned to the Senate Education Committee this year than they can possibly address. One that they're dealing with right now is the School Employee Criminal Background Check bill. That there have been some questions raised about how that bill is going to affect janitorial staff, athletic staff, food service staff, and others. So lots of activity in the education area. And of course the media covers probably the more provocative kind of bills like cursive writing or school prayer, athletics, or concussions on the football field. But know that the House and Senate Education Committees are dealing with a lot of very detailed kind of education bills. On the healthcare side, Mark already gave you a pretty good overview that Indiana has a number of decisions to make in terms of how Indiana implements the Affordable Care Act. As Mark mentioned, the governor has already indicated that Indiana will not create its own health insurance exchange, but there are decisions to be made about what type of health benefit plan will be offered. What kind of oversight will Indiana have over a benefit exchange or over the plans that are offered? But the really big questions are whether or not Indiana should expand Medicaid, what that expansion would look like, and what to do with the Healthy Indiana Plan, because currently the Healthy Indiana Plan, which is a pay-in plan for low-income but working Hoosiers, that plan will, the waiver that we have from the federal government for that plan will expire. There are other decisions that need to be made around how are we going to implement this new model, and what do we do about the potentially uninsured 450,000 Hoosiers who will still not have access to health insurance after the exchange goes into effect if we don't expand Medicaid. So those are some of the big decisions that's going to consume a lot of time and energy in the State House. Where both ICHS and IUW have a lot of interest is in the financial stability area, and there are a number of bills that I'll let Mark describe.
Well, very quickly, there's issues around eligibility benefit issues. There's a discussion about trying to spread out the SNAP benefit payments so that it's done over a number of days in the month as opposed to being up front. It makes good sense both for purposes of management by the retailers and actually for the individuals. The problem there will be how do they handle such a changeover here and such. But there was a hearing on that yesterday, and the committee seems sensitive to that. Senate Bill 559 is called fraud, but it actually deals with issues around what is being considered by the author to be fraud on the part of Medicaid recipients. And that still had some discussion. Senator, the chair of the committee asked the senator that sponsored the bill to go back and work on it some more. So that's still coming along. It was a similar issue was brought up last year, and it just didn't really make any headway. There's two different bills that talk about drug testing to receive benefits, focus on TANF benefits with that here. Some of you may recall that that was this issue of active discussion last year. I think it remains to be seen. The concerns that the Coalition for Human Services and others have expressed are still there, and we're in discussions with those authors about this. There's also a question about the study of free and reduced lunches. And what's driving that is the school funding formula, because how many students receive free and reduced lunches is a factor that's used in terms of deciding how much support from the state each school gets. So there is an active discussion about that, and it's really not about free and reduced lunches as it is about how they distribute school funding. Individual development accounts are being considered and discussed in terms of the total appropriation and also the expansion of it to use dollars to pay for cars. Earned income tax credit, there is nothing that has been filed yet specifically about that, but there has been this discussion about who receives the earned income tax credit and why and how. So we're continuing to monitor for that. The other ICHS priorities revolve around safe and affordable housing resources, how utility deposits are handling, some work sharing activities and such. The United Way is concerned about streamlined eligibility benefits, employment supports, and child care subsidies.
And Mark, I realized after we sent these out that we neglected to put the second chance law, and that falls into this category. There is some great attention through that criminal sentencing reform package about making sure that ex-offenders do have a chance at getting jobs, and we are, from both a coalition perspective and an IUW perspective, monitoring that because we know that employment and unemployment is really tied to that ex-offender issue. So that's one other issue that we're following. So I'm going to move on and tell you about a great new resource that we have available. And that is the Guide to Safety Net Programs. We have developed through Indiana Coalition for Human Services a quick guide, and I'm going to pull it up, that actually shows the, if you come to the ICHS website, you can click on the Guide to Safety Net Programs. We designed this to help guide policymakers, to help them understand the different programs. So you can see here, this is the guide itself, and in the guide it includes information about, for example, who is eligible for SNAP, what is the maximum income threshold, how does the program work, how many people are actually receiving SNAP in Indiana, and then a slight picture or a sample constituent who's using SNAP. We know that there's a lot of confusion about these eligibility programs, especially as they're hotly debated in Congress, and there's a lot of misinformation. So we've put this little safety net guide together through the coalition to help our policymakers understand. And if any of you on this call, on this webinar, would like to use that, you can download it, or if you have a meeting that you're planning on attending, contact us and we'll see how we can help you out. But we thought we'd want to make you aware of that new resource. Next, let's talk about child services. And again, Mark mentioned earlier that the study committee last year that was really looking at how, what were some of the challenges within the Department of Child Services, particularly focused around the centralized hotline. So there are several bills that would create new positions, both in casework and supervisor positions, develop new process for handling those child abuse and neglect reports, and from really distinguishing who are the mandatory reporters, and should those mandatory reporters who call something in, like a judge or a police officer, should their report be treated differently, and that's part of that new legislation. There's a number of other bills dealing with children, one that's coming out of that committee, and that's actually the development of a commission on child services, and that would be to oversee the DCS program, because that was one of the areas that was identified through that summer study committee. A number of other issues are being followed, things like how to address bullying, school discipline issues. Can you get disciplined for something that a young person does out of school, particularly on the internet with social media? There's a gang bill again. There are lots and lots of bills that deal with children. Mark, do you want to talk about some of the legislation around strong communities?
Yes. One is this transit option here in Marion County and the surrounding counties. This is an issue about allowing a referendum to be had in Marion County and surrounding counties about raising their local option income tax and dedicating part of that to revenue. The bill is rather large, but it focuses a lot of the bill on operational kinds of things, mechanical things here. But they had a hearing yesterday, well attended. The bill's anticipated to pass the House, but that the Senate prospects are still uncertain at this point. But it may set a pattern for other counties to consider in the future about paying for transportation activities. The Neighborhood Assistance Program tax credits. Many of you on the call may be aware of those or actually receive some of those tax credits. There's been some discussion about cutting that back or reducing it. We've not seen anything specifically yet, but we're aggressively monitoring that and stand ready to push back. There's some issues about property tax exemptions for charities out there. There's always some odd and end bills that relate to some specific entity that failed to pay its taxes when they needed to. But there's this, as they look at local government revenue, there's this discussion about what should or should not charities pay for in terms of property taxes. Not expected to make a lot of headway there, but it's certainly something there. The statewide 211 network. Lucinda could give you a small seminar on that. But the 211 network, which many of you are aware of, works out there, but it operates with limited funding. And in many counties, it has no funding. So there is still some efforts to try to find a permanent funding source for that. There's other issues such as firearms and livable communities that are out there. There are some issues out there about who could carry firearms and under what circumstances, and that's somewhere between a policy issue and a social issue. So far, the issues on firearms have not hit a committee, but it still waits to be seen how those committees handle the bills that have been filed on that.
Okay. Thanks, Mark. I'm looking through the questions. I saw that we had a question about NAP, so I think you've answered that. So the answer around the NAP question, the question is, what is the state of NAP? We're not aware of any effort to take away the NAP credits or to not fund the NAP credits at the same level, but we are aware that it is always a risk, especially in those final hours of the budget writing session, and we stand ready to try to protect them. We had another question from Laura Benton. I don't know what her question was. She raised her hand, so if any of you have questions about specific bills or specific issues that we have mentioned so far, please include those in the chat box. I know that we have not listed specific bill numbers for a number of the issues that we have mentioned. And the reason why is that for a number of those issues there are multiple bills, and we'll talk about bill lists in just a moment. So we will come back and show you how to access more detailed information about any of those issues. So let's move on just a little bit more, and we will talk about how you can engage. We only have a handful of minutes left, but I know many of you are already aware or you would not have been on this call. So first of all, let me just say matter-of-factly that nonprofits may advocate, nonprofits may lobby. You can absolutely do as much education of your community, of your board, of your staff and volunteers about the importance of these issues and how they tie to how your program ties to policy. The key is to know the rules and to have your board members and your volunteers tell the story, because all of the rules about tracking how much time or energy you're spent or money you're spending on advocacy or lobbying or grassroots efforts, that doesn't apply if you're talking about your volunteers. So generally speaking, nonprofits are allowed to engage in the full continuum of advocacy activities, from monitoring bills to participating in coalitions to holding educational forums or helping mobilize stakeholders and clients through grassroots organizing or actual direct lobbying, which is where you contact your legislator and say, please vote yes or please vote no or support this effort. That's direct lobbying. A number of us, as a part of the Indiana Coalition for Human Services, are registered lobbyists, so you have lots of friends in the State House working on your behalf right now. So how do you get started? I think this is pretty self-explanatory, but the key is, if you haven't already, try to figure out which key board members or committee members might be willing to help you from your own organization, because it needs to be beyond just the staff. Maybe they're willing to sign a letter to the editor or to write a guest column or to be interviewed by the media, or maybe they're willing to attend meetings with you. So for example, if we issue a press release from the Indiana Coalition for Human Services, it comes out from Indianapolis. Those of you who are in South Bend or Fort Wayne or Lake County or Evansville or Columbus, you know, your local newspaper is going to want to interview someone locally, not want to talk to somebody from Indianapolis. So it's really important that you have those key people who can help provide the education and educate folks. So what can you do? You can certainly reach out to your legislator. The legislators' addresses are generally an H for the House member, their district number at in.gov, or the Senate is S, their district number at indiana.in.gov. You can send an email. Know that when you get a forwarded email from an organization, it's really important for you to customize that email to provide your home address information and your home contact information so that your legislator knows that you are a constituent and that you vote. And this is why this issue is important to you. Again, we talked about guest editorials or letters. Another thing you can do is you can help find and prepare individuals to testify. You know, maybe you have a client who has the perfect story about why it's so important that we have health care in Indiana, why how folks just end up uninsured through no fault of their own. You might want to be able to attend a third house session. Third house sessions are opportunities for you to go and meet with your legislators, and I'm going to show you in just a moment where some of those resources are of how to find a third house session in your region. We always encourage folks to start with their board and to map your relationships. We sort of tease that you can do it Kevin Bacon style, and that's sort of that 6 degrees of separation from Kevin Bacon, where you may not know your legislator, but you know someone who knows someone who knows someone who knows your legislator. And you just have to find that web of connections to make that connection. We encourage you to promote and interact at every opportunity. You never know when you're going to be standing behind your legislator at the grocery line or at a restaurant, and we encourage you to really have your elevator speech ready about why you do what you do in human services. Why do you work? Why do you volunteer with people with disabilities or with the elderly or with victims of domestic violence? And really share your story, because, again, a lot of these legislators are new. They are learning an incredible amount of information all at once, but they need to know why it's important to you as a constituent and why this issue is important in your community. If your organization has a State House Day, like United Way has a State House Day on February 5th, and for our United Ways and our United Way partner organizations, we encourage you to participate in a State House Day. There's nothing like really showing your support at a State House Day. I see that we have a couple questions, and I'm going to try to get to those. Let's see. State House Days. Okay. I don't know that we have that one of the questions is there a place that centrally lists State House Days? I'm not not aware of a list that does that. There is, through the Indiana Chamber of Commerce, they maintain something called Indiana Net, which is one of the services that we have access to through the Indiana Coalition for Human Services, and it maintains a social calendar where we can see which organizations, you know, that the pork producers are there on such and such a day, and the realtors are there on such and such a day, and United Way is going to be there on February 5th. Let me look through the other questions very quickly. Yes, we have a question about the NAP credits. We are aware of a particular bill by Representative Turner, and we are still researching what his intent was there. We will certainly send that out in our newsletter. We have a question about the school resource officers, Senate Bill 1, now that it's moved to the Appropriations Committee. I am not aware of the latest on that, but I will ask my colleague Mark. Do you know anything about the school resource officers bill?
No, I don't.
Okay.
But keep on talking. I'll take a quick look.
Okay, he's going to find that out for us. And then we have a question about where is the child care licensing issue headed, and where we believe that that is headed this year. You know, we at Indiana United Way have been advocates of increasing the standards at the bottom level so that the minimum requirements to accept federal funds especially are really equal across all types of providers. Right now they're not. There are certain exemptions for certain types of providers, and we believe that if you take state money, there should be a higher level of standard across the board. We are confident that something will move forward, but we're not sure what that will look like. We know that it's the conversation is really about quality and not so much about licensing. So there's a recognition that the Paths to Quality program in child care, those levels on the Paths to Quality, level 1 is that level 1 licensing, but a level 3 or level 4 provider, which is how the pre-K pilot is actually structured. The level 3 and level 4 providers have licensing plus curriculum, and if they're level 4, actually accreditation. So I think we're caught up on our questions. I apologize, but I wanted to make sure that we get our questions as we move forward. So I'm going to
the issue about school resource people has been signed to the Senate Appropriations Committee. It was authored by State Senator Pete Miller from out in Hendricks County, and that's as far as it's gone at this point.
Okay. So
Lucinda,
the question is, yes.
There's 2 more questions I just sent over.
Oh, okay. And let me go back to the school resource. So for those who don't live, eat, sleep, and breathe legislative activity, school resource officer, the bill is about to put more school resource officers in schools, to put some money behind it. There's a rule that in the Senate that if a bill has a fiscal impact to the state of more than $150,000, the bill must be recommitted to the Appropriations Committee so that it can be included in the budget. So anything that's higher than $150,000 has to be recommitted, and often, quite frankly, good ideas go to be modified or die in the Appropriations Committee if the leaders of the Appropriations Committee don't find that it's high enough priority or there's just not enough money. There's certainly lots more good ideas than we have money in the budget.
And this bill appropriates $10 million to the Indiana Safe School Fund.
Yes. Okay, so I have 2 more questions. One is about a deadline around Medicaid. So it's an interesting question about the deadline because anyone who works in healthcare knows that the Center for Medicare and Medicaid Services, CMS, has changed a number of the deadlines as we move on. The way that ACA is written is that the health insurance exchanges and things need to be in place for 2014. And so in order to start thinking about a Medicaid expansion for 2014, we would need to make a decision essentially, since this is a budget year, by the end of the legislative session. Certainly the governor could call a special session at another date, but generally speaking, healthcare advocates are assuming that the legislature will need to make some final decisions by the end of the legislative session. And those sort of inside the State House, the sort of inside scoop, is that a lot of projects are being sort of delayed or waited. We're waiting to see what the revenue forecast looks like, and there will be another revenue forecast at early April. And that's why we believe that that sort of late April period will be a critical time for making those final decisions. Let's see. I'm seeing another question around federally qualified health centers and their roles. I'm not aware of any particular bills specific to federally qualified health centers, and I apologize. I have not done anything but to put a bunch of healthcare bills on a bill list so far. So there may be, but I'm just not aware.
Nor am I aware of anything on a federally qualified healthcare center.
And then lastly, the governor's reauthorizations regarding trauma-informed care. Can we speak to that? I'm not aware of that at all, but we can certainly do homework. If we have your email address for any of those questions, we will try to follow up. I'm going to zip back to we have just a couple more slides just to show you a couple resources that are available to you. So we encourage you, how do we work together? IUW, ICHS, and then all of you on this call and all of your partners. We work together. We try to keep you informed through our newsletters. IUW has a policy update that comes out every other Friday, or odd Fridays actually, first, third, and fifth Fridays. ICHS has a newsletter now that comes out every other week, so we encourage you to go to the ICHS website and sign up so that you can receive that every other week, and we actually include the links to those particular bills that we're tracking. We encourage two-way communications where you will communicate with us, give us feedback, ask us questions, and we try to keep those. I'm going to show you how we post bill lists and third house lists. And we work with a number of coalitions. Indiana Coalition for Human Services, of course, is a partner on this call, but there are some others like the Children's Coalition of Indiana, the Healthcare Implementation Work Group, and the Transit Coalition that's really advocating for the transit. So let me just move back over and just show you, for example, if you look at the IAUW website and you go to the public policy side, which it's kind of hard to find, but we'll make sure it's a little bit easier to find. On the public policy page for IAUW, you can pull up, for example, our policy priorities and actually look through what our policy priorities are. You can go to the third house list, and we actually update this every week. This shows you where legislators are hosting those events. They're typically hosted by a Chamber of Commerce or a League of Women Voters or a public library, and you can see when they're having those meetings. They're usually about an hour or two long. The legislators who cover that region will come in and give a short presentation about what's going on currently in the session, and then they'll take questions from the audience typically. And if you're nervous about going for the first time, find someone in your community who also goes to those meetings. Then we'd like to show you, excuse me for just a second, the bill tracking list. So this is an example of a bill tracking list where we actually, through IUW, through our priorities, we pull off what are the lists, what are the bills that are currently sort of top priority to us or that we are following because we're interested in. So you can see some of the early childhood education bills that we are following, and those are on our early childhood list. We also have bills on our financial stability list, so I'm just flipping through here. You can see the general education bills, and in the same way, ICHS also has its own bill list. So these are through IUW. If you have questions about nonprofit lobbying or our day at the State House, that's where that is. Let me pull up the ICHS website so that you can see. ICHS also maintains its own bill list, and all that information that we just shared about the Pence budget and the safety net. So you can pull up the ICHS priority bill lists, and that would allow you to look through, for example, the budget bill, if you want to see what's actually going to be in the budget bill, or what those career councils might look like, or that bill about the free and reduced lunch program that Mark talked about. So, and by clicking on that, the link is hot, so you could actually click right through the bill and read it. So those are just a few of the resources that we try to provide to you. The websites are there listed for each of those coalitions, and know that coming soon there will be a Medicaid expansion campaign website. We've also listed some other helpful websites, including the Indiana Lobbying Registration Commission, which is really important. And then if you do a lot of lobbying of the executive branch, which would be contacting FSSA or State Department of Health, and really, or the governor's office, trying to push through a particular proposal, not responding to a proposal, but pushing through one. There are some websites there. And then lastly, you see our contact information, both mine, Lucinda Nord, or Mark's, available. And we invite you to feel free to call with questions or email us if we mention something that you'd like to know more about. And I'm sure any of those coalitions that we referenced earlier would welcome your participation in their coalitions. So I'm going to go back and ask if there are any other questions that we've had, because I see we're coming to the end of our time together. Are there any other questions? Let's see. All right, I'm not seeing any other questions. If we missed your question, we will follow up after the webinar with a survey about what you thought of this webinar and what other kind of information you would like to see in future webinars. We aim through this type of effort to try to keep you informed. We know that going to conferences, going to trainings is very expensive for a lot of nonprofits, or actually for some it's trying to find the time in your very busy schedules. So we try to collapse a lot of information into a very brief webinar for you. We thank you all for all that you do on behalf of people in need in Indiana. The human service community is very rich, and we know that it's been under a lot of strain in recent years, and we just really so appreciate all the work that you do and the ability to work together through coalitions and as partners in helping advocate for the people that we really care about. So on behalf of Indiana Association of United Ways, Indiana Coalition for Human Services, and the Indiana Nonprofit Resource Network, again, the statewide training organization for nonprofits, we thank you for participating in this webinar, and I think that will be all. Anything else from Mark or Lisa?
Thank you, Lucinda and Mark. This has been great information. We really appreciate partnering with you and having the deep level of knowledge and expertise that you both bring to this.
Thank you. We'll see you soon.
Bye.